Good morning. This is Angie from Daisy Family Health. Gosh, I gotta stop saying good morning. It's like a habit because it's morning when I'm doing this video, even though it may not be morning when you're watching it. Anyway, we are gonna talk about lupus today. So happy May. Happy belated Mother's Day to all the mothers. And we're gonna talk about lupus. It's very common, and many of you have either heard of lupus or you know someone that has lupus. And it comes in many forms. The most common form is SLE, systemic lupus erythematosus, blah, 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 right? If you do know someone, they probably have that form. And basically what it is an autoimmune disease, and it insults multiple organs in the body. Most common characteristic that we learned back in the days was the butterfly rash, where you get the rash that kind of goes across the cheeks like that. Really inflamed and red. And I bet many of you, like me, thought you had lupus at several points in your life, because I have sensitive skin, so I get the rash all the time. And I've probably been to see someone about 3 times in my life thinking I have lupus, because I had other characteristics. I had the fatigue, the fever, the achy joints. At one time I had a urinary tract infection and spilling protein in my urine, but I did not have lupus. So if you ever thought that you had it, you're not alone, because many of us feel the same way. Um, I will give you some statistics on lupus right here, okay? If there is a person, well, women, so is women 10 to 1 when it comes to men, so it's most common in women, and it's most common in people of color, African Americans, Hispanic, Asian, Native Americans, okay? Caucasians is least common. And then if you do have lupus, the woman has I gotta read this, this is crazy. Women with SLE have a 7 to 50-fold increased risk of coronary artery disease. All right, and they may present with atypical symptoms, which means you might not get the classic chest pain with the pain radiating down the arm, or the pain kind of right here, epigastric area. So they may not present with the classic symptoms. So as a provider, we have to kind of pay attention. And then prevalence, it occurs in 30 to 50 out of 100,000 people, because people are living longer and they're surviving. So that's a good thing though, right? And let's see. One thing, it also is kind of hard to diagnose because it overlaps other diseases like fibromyalgia, rheumatoid arthritis. Um, One thing that is a gold standard test is a ANA test, which is a anti-nuclear antibody test, and that has like 95% of people with lupus test positive for that. So that's one of the tests that is usually done right off the bat. Other risk factors: UV light, infectious diseases, stress, diet, drugs, hormones, vitamin D deficiency, and tobacco. So there is a drug-induced form of lupus as well. So it's sad, but that is a risk factor. Other presenting symptoms, let's see. We talked about the rash, maybe ulcers within the mouth. All right, arthritis, myalgia, which is like muscle pain, okay, and shortness of breath and coughing. One of the major organs that's affected by lupus is the kidneys. So there's a lupus nephritis, and you see people with lupus who need a kidney transplant. So kind of sad, but it's a debilitating disease. It can go from mild to severe and life-threatening, and it has flares, just like fibromyalgia, just like rheumatoid arthritis. Certain things can cause a flare-up, so that's why we try to keep it at bay. First-line treatment is I just had it here. because my brain, my brain doesn't work. Oh, anti-malarials. Yeah, that's the first line treatment. Then second line, and with steroids. And then second line is the methotrexate. Somebody has lupus should be seeing a rheumatologist, definitely. And most times they have the fibro and the RA with lupus. Sorry, fibromyalgia and rheumatoid arthritis. So they should definitely be followed by a rheumatologist. And with the different studies and all the advances in healthcare, people are living longer lives. It's just sad to see the flare-ups. I know people, I have friends who have the flare-ups and they're in the hospital for 3 or 4 days, and they're just down, like severely down and out. And with the lungs and the heart and the kidneys, it's a debilitating disease. But once you learn to take care of yourself and your body, you can try to keep the disease mild. Yeah. All right. I'm at 6 minutes, dog it. So thank you for watching, and maybe we'll talk about, I think I have skin. Yeah, talk about skin, because not just because it's that time of the year, but it's awareness month for it too. All right. Y'all have a great day.